My name's Doug Penzey. I'm a radiology doctor. I work at University College Hospital and also at the Centre of Medical Imaging at UCL. So the role of imaging in cancer can be divided into detection of cancer, planning and monitoring of treatment, and also the follow-up of patients after they've had their treatment, such as chemotherapy and radiotherapy. Standard imaging techniques rely simply on looking at the size and shape of tumours. We know if something's got better because it's got smaller. We know if something's got worse because it's got bigger. These techniques are quite crude and really insufficient for the modern treatments that we have available to us today. The broader aims of this research fit into the shifting paradigm of cancer imaging, which is to evaluate cancer biology and physiology rather than simply the size and shape of tumours. By using new functional techniques, we hope to be able to improve the ability of our doctors to detect, to treat, and to monitor patients with cancer. I'd like to introduce you to my colleague, Simon Walker-Samuel, who will explain the project to you in more detail.
My name's Simon Walker-Samuel. I'm a physicist by training and I work at the UCL Centre for Advanced Biomedical Imaging. So my main interest is developing techniques for imaging and characterising tumours. And one particular technique is diffusion MRI, and this uses the motion of water through cancerous tissue as a probe of the microstructure of the tumour. And one thing we've been able to show recently is that we can use a new technique we've developed with Danny Alexander at CMIC called verdict MRI, and we can measure the exact size of tumour cells in tissue and get the kind of information we'd only otherwise be able to get by biopsying a patient, which is obviously very invasive. The techniques that I'm trying to develop are entirely non-invasive, so we can look inside the patient without having to open them up and characterise their disease, and also try and develop methods to assess response to therapy. So currently, as Doug introduced, the only way of assessing response currently using imaging is to see a change in size of the tumour. But for novel therapies, this is fairly inadequate because a lot of the novel therapies don't induce a change in size of the tumour, rather a change in function. And we want to develop the next generation of imaging techniques that will be able to characterise these changes more robustly. UCL is unique in its provision of medical imaging devices, both in the clinical context, so in its hospitals, but also in its provision of experimental imaging devices. For example, at CABI we have 8 in vivo imaging devices, 2 MRI systems, PET, SPECT, CT, ultrasound and bioluminescence, all of which can be used to develop techniques that can be translated into patients.